Good evening once again. I'm Chris Jansing in for Brian Williams, day 195 of the Biden administration. And the Delta variant is tightening its grip on the nation, driving up COVID cases and hospital admissions. The U.S. has now recorded over 35 million cases and is averaging about 70,000 cases a day. Late this afternoon, the CDC director revealed new data on the dangers of this hyper-contagious Delta strain.
If you get sick with the Delta variant, we estimate that you could infect about 5 other unvaccinated people, more than twice as many as the original strain.
Researchers at Johns Hopkins University have found 5 states, California, Texas, Louisiana, Missouri, and Florida, represent 46% of new U.S. COVID cases. Earlier today, officials in Louisiana offered a grim assessment of the situation. That state is set to break its all-time record for COVID hospitalizations.
Nobody should be laboring under the misapprehension that this is just another surge. We've already had 3 of these. This is the worst one we've had thus far.
This virus, the Delta variant of COVID, is every infectious disease specialist and epidemiologist's worst nightmare.
As federal health officials have repeatedly warned, we are now in a pandemic of the unvaccinated. And today, the White House said some 90 million Americans have yet to get one of the 3 vaccines available. Yet there are some signs that those holding out may finally be coming around. As of today, the government says 70% of Americans have received at least 1 dose of the vaccine. The president had originally hoped to reach that goal by July 4th. Administration officials also say they're seeing a trend of rising vaccinations.
Over the past few weeks, we've seen a nearly 70% increase in the average number of new people getting vaccinated each and every day. In the last 7 days alone, 3 million Americans have gotten their first shot. That's the highest 7-day total since July 4th.
We're also learning more tonight about so-called breakthrough infections, which occur in people who are fully vaccinated. A new study by the Kaiser Family Foundation finds those infections are reported in less than 1% of the fully vaccinated. Tonight, Senator Lindsey Graham is among them. He revealed he tested positive for COVID today, saying he began having flu-like symptoms Saturday night. The senator says he'll be in quarantine for 10 days and went on to say, quote, "I am very glad I was vaccinated because without vaccination, I am certain I would not feel as well as I do now." Graham was one of several senators who attended a Saturday gathering on West Virginia Senator Joe Manchin's houseboat. Manchin says everyone on board was vaccinated. And so far, Graham is the only one known to have tested positive. Michael Osterholm, what are we now doing? Where are we in this latest surge?
Well, first of all, you have to understand that we don't really know why surges occur. What happens that suddenly causes this big increase in cases? And why do we see a very sudden drop within 5 to 7 weeks of the top of the surge? That's been happening around the world. I expect the same to happen here. I think probably another 4 to 5 weeks, and we're going to see these numbers drop precipitously. But in the meantime, we're in trouble. Right now, tonight, if Louisiana was a country, it would actually have the highest rate of cases in the entire world for any country. That's how bad things are. And I don't think people yet really understand that that's the challenge we have for these next 5 to 6 or 7 weeks.
And 5 to 6 to 7 weeks, schools are already opening in some places, and many will be open in the next 4 weeks or so. Children under 12, though, of course, can't be vaccinated yet. And there are states that not just won't mandate masks in school, they are forbidding schools to have mask mandates. So what concerns you most about kids in this scenario?
Well, we have to understand that, first of all, we do have 100 million people in this country who are not vaccinated, of which half are children. We do know that this virus transmits readily to and by children, and that unlike early thoughts that this spared children, it surely doesn't affect them at the same rate that we see serious illnesses in adults. It still does affect them. It causes an illness that, in terms of deaths, far exceeds by 2 or 3-fold the number of deaths we expect to see with influenza. So we don't want kids to get infected. Also, we don't want them to get infected because they're bringing it home. We now have clear and compelling evidence that in households, kids can bring the virus home to mom and dad, grandpa and grandma, to people who may be at increased risk of serious disease. So this is going to be a challenge. And we just have to acknowledge that. We can't use any, happy talk to say that somehow we can start schools again and everything will be okay. We want our kids in school, but we have to understand there's going to be challenges.
Yeah, and those challenges mean, Ashley, that the White House now finds itself fully back in the middle of this pandemic, even for this critical week when this key item agenda in his agenda, he's trying to get the infrastructure bill to pass, is right on the docket. What's the atmosphere like at the White House right now as these two issues collide?
Well, the White House is privately concerned and understands that they have a real challenge with the Delta variant. You can even just look at today's White House briefing, which for starters was delayed several hours, no explanation given other than, quote unquote, a lot was happening. But a lot of the questions, again, on a week when they want to be pushing infrastructure, the bipartisan deal, and also their more Democratic progressive plan to pass through reconciliation, a lot of the questions dealt with coronavirus, which they came in and said was one of the 4 major crises of the administration. And they have not yet solved it. And they are grappling now what Delta variant has done is a messaging problem, because they have to talk about the breakthrough cases, which in some ways is a complicated message that undermines their key thing, which is still the utmost important, which is that everyone needs to get vaccinated. So they're trying to say everyone needs to get vaccinated, and yet you may be vaccinated and you might have a breakthrough case, but you absolutely still need to get vaccinated. In public health crisis, when messaging is key, this just throws another wrench in complicated messaging.